Hi guys, welcome to Pulses Experience. Today we are going to discuss hypolipoproteinemia. See, if you know this topic properly and get the questions correct from this topic, your rank will boost up. Okay, so this becomes important. See, first is A beta lipoproteinemia. What is A beta lipoproteinemia? In this, somehow MTTP doesn't work. So let's understand what is MTTP. This MTTP converts TAG into chylomicron and all other things. So if this won't be functioning, then all things will decrease like chylomicron, VLDL, IDL, everything. Okay, but HDL will be normal because HDL is not related to MTTP pathway. Okay, so if examiner is trying to frame question from only the serum level, then you will have to look for one thing that will be very important, and that will be normal HDL. Okay, and rest everything will be decreased. Now let's try to catch its clinical feature. Okay, this is from the first aid. A beta lipoproteinemia is autosomal recessive. Okay, this MTTP doesn't work, so there will be decrease in all these things. So now we know that chylomicron is required for fat absorption, so vitamin A, D, E, K will decrease. Also fat will not be absorbed, so there will be diarrhea, steatorrhea, failure to thrive, and retinitis pigmentosa, spinocerebellar degeneration. Okay, because myelin is required, vitamin E is required for myelin. Okay, what are the other things which will cause spinocerebellar degeneration? We know, very important, vitamin B12 deficiency, copper deficiency, and vitamin E deficiency. These are the three things you never have to forget. Okay, these are very important. So the patient will have spinocerebellar degeneration. So because of this he will have ataxia, and there will be somehow involvement of DRG, and when DRG is involved we get positive Romberg sign. Okay, Romberg sign, that is also known as Wash-Basin sign. So there in peripheral smear, how to catch this disease, there will be acanthocytes. Okay, and on biopsy you will see lipid laden enterocytes. See, these white are lipid laden enterocytes. Okay, now you will have to understand that can we diagnose A beta lipoproteinemia alone on biopsy? Yes, we can diagnose, but you have to remember that celiac disease cannot be diagnosed alone on the basis of biopsy. We also require serology, is more important in celiac disease, that is antibodies. Okay, now what is the treatment? We have to restrict long chain fatty acid because fat is not getting absorbed, it will aggravate the symptoms, and we need, most important, vitamin E. And what will be the other features which you can derive from this? C, vitamin A, D, E, K will be deficient, so vitamin A deficiency features, vitamin D deficiency features like bone problem. Okay, vitamin E I told you, vitamin K deficiency problems. Now also why ApoB48 and ApoB100 is written there. See, we know that ApoB48 is specific for chylomicron and ApoB100 is specific for LDL. Okay, so this will be decreased. Second is fish eye disease. For understanding this, we need to understand HDL metabolism. Somehow LCAT is deficient in this. LCAT is directly related to HDL metabolism. Now let's see HDL metabolism. See, this is liver, intestine, both secretes HDL. Okay, now this is in the discoidal HDL forms, means in its surface it has cholesterol. Okay, so when there is LCAT enzyme is responsible for converting cholesterol to cholesterol ester, and we know that cholesterol is amphipathic. Okay, but cholesterol ester is water hating, that is hydrophobic, so this cannot be on the surface, it is internalized. When this is internalized, this discoidal HDL is now called spherical HDL. Okay, and when it passes through the capillaries, the peripheral tissue keeps on giving cholesterol to this spherical HDL, and this ultimately goes to the liver. Okay, so this is known as reverse cholesterol transport, and it is excreted as bile acid. So HDL is good cholesterol. Now see, when spherical HDL is about to take cholesterol from the periphery, then it requires one transporter that is known as ABCA1. So when ABCA1 will not work, it is known as Tanger's disease. So in Tanger's disease, we can say that HDL will not function, so HDL will be decreased. Similarly, in Norum's fish eye disease also, when LCAT won't work, HDL will be low. So See, in A beta lipoproteinemia, HDL was normal, but here HDL will be low. This is the most important point which you have to remember. In Norham's disease, there is complete LCAT deficiency. Okay, same profile, HDL will be low, VLDL will be high. Here HDL is normal, and see, this looks like fish eye. So this is partial LCAT is fish eye disease, complete LCAT is Norham's disease. Incomplete, so there will be additional feature like end stage kidney disease and opaque cornea. Okay. Now, Tangiers disease, this yellow tonsil, if shown in the exam and asked what is this, then this is Tangiers disease. Okay, so as I told you, ABC A1 खराब हो जाता है. Because of that, cholesterol from the peripheral organ won't be able to give cholesterol to the HDL. So somehow HDL won't be able to function. HDL will be decreased. How to remember that it is ABC A1 and not 3? See, T is T, we can make this like ulta 1 and then again A1. Okay, Tangiers disease, so it is A1. Now it has hepatosplenomegaly and peripheral neuropathy also. At last, some extra points. See, lopetamide blocks MTTP used in hyperlipoproteinemia. Now mnemonic, what are the mnemonics which you can take? See, how to remember that A beta lipoproteinemia is MTTP only. See, beta means child, and if you don't want child, you will have to do MTP. So that is A beta lipoproteinemia. Again, I told you this mnemonic. And then lopetamide, lopeta is pita, pita means father, father is related to MTP. So you will always remember this. Now, cytosterolemia is one additional point. It is a type of hyperlipoproteinemia, but I have included it here because I want you guys to know that it is related to ABCG5 and not 1 or something like that if examiner tries to confuse you all. So this is cytosterolemia. This looks like 5. So ABCG5 and G8 are defective. This is responsible for excreting plant cholesterol. Somehow this secretion is blocked, so LDL is decreased at last. Now tell me in the comment section what is the function of evolocumab. Okay, it was recent INI CT question. Thank you guys.